Life can be fragile, and in moments of severe illness or injury, the body's natural functions may falter. Sometimes our bodies need help to keep going, especially when vital organs are compromised. Life support machines offer this help by taking over or supporting essential bodily functions. They are medical devices that perform essential bodily functions such as breathing and circulation when our organs fail. These machines can be the difference between life and death, offering patients a second chance at recovery. Imagine a patient with a severe lung infection, struggling to breathe and unable to get enough oxygen. Their lungs struggle to deliver oxygen to the body, leading to a critical situation. A life support machine, like a ventilator, can breathe for them, ensuring continuous oxygen supply. It ensures the body receives the oxygen it desperately needs to survive and function. These machines are sophisticated and complex, designed with advanced technology to support life, yet their purpose is simple: to sustain life by performing critical functions that the body cannot. They help patients survive critical illnesses and injuries, providing time for the body to heal and recover. Life support machines represent the power of modern medicine, showcasing the advancements in medical technology. They are a beacon of hope in moments of medical crisis, providing a lifeline when it is needed the most. Perhaps the most well-known life support machine is the ventilator. These machines have become a symbol of critical care, especially during the COVID-19 pandemic, where their importance was highlighted globally. Ventilators were in high demand, and their availability often determined the survival of critically ill patients. Also known as a respirator, this machine assists or takes over the breathing process for patients. It is essential for those whose lungs are not functioning adequately. Ventilators can be set to deliver breaths at a specific rate and volume, ensuring that patients receive the necessary respiratory support. It does this by delivering oxygen to the lungs and removing carbon dioxide from the body. This process is vital for maintaining the body's oxygen levels and ensuring that organs function properly. Without adequate oxygen, organs can fail, leading to severe complications or death. Ventilators are commonly used in intensive care units. They are indispensable tools in the management of critically ill patients. In the ICU, ventilators are monitored around the clock by medical staff to ensure they are functioning correctly and meeting the patient's needs. They are crucial for patients who cannot breathe on their own due to conditions like pneumonia, lung injury, or during surgery. In such scenarios, ventilators provide the necessary respiratory support to keep patients alive. The machine can be life-saving, offering a bridge to recovery while the underlying condition is treated. The ventilator connects to the patient through a tube inserted into the windpipe. This procedure, known as intubation, is performed by trained medical professionals. Intubation ensures that the airway remains open and that the ventilator can deliver breaths effectively. This tube acts as an airway, allowing the machine to deliver breaths at a controlled rate and volume. Ventilators are highly adjustable, with settings that can be fine-tuned to match the patient's specific respiratory needs. These settings include the amount of oxygen delivered, the pressure of each breath, and the rate of breathing. Doctors tailor the settings to each patient's needs, ensuring they receive the right amount of oxygen and breathing support. This customization is crucial for the patient's comfort and recovery. Continuous monitoring and adjustments are often necessary to respond to changes in the patient's condition. This personalized approach is key to successful treatment and recovery. With the right care and monitoring, many patients on ventilators can recover and regain their ability to breathe independently. The goal is always to wean patients off the ventilator as soon as they are able to breathe on their own, reducing the risk of complications associated with prolonged use. Our kidneys act as filters, removing waste, excess fluids, and toxins from our blood. They also help regulate blood pressure, electrolyte balance, and red blood cell production. When kidneys fail, dialysis machines step in to perform these vital functions, ensuring that waste products and excess fluids are removed from the body. Dialysis machines act as artificial kidneys, cleansing the blood of toxins, balancing electrolytes, and maintaining fluid levels. There are two main types of dialysis: hemodialysis and peritoneal dialysis. Each type has its own method and equipment for filtering the blood.
Hemodialysis involves diverting blood to an external machine where it's filtered through a dialyzer. which acts as an artificial kidney. The filtered blood is then returned to the body, free of waste products and excess fluids. Peritoneal dialysis uses the lining of the abdomen, called the peritoneum, as a natural filter. A special dialysis fluid is infused into the abdominal cavity. The fluid absorbs waste products and excess fluids from the blood vessels in the peritoneal lining and is then drained out of the body. Dialysis is a lifeline for patients with kidney failure, providing a critical function that their kidneys can no longer perform. It helps them maintain a balance of fluids and electrolytes in their bodies, which is essential for overall health and preventing complications. By preventing the buildup of harmful waste products, dialysis machines help patients avoid severe health issues and improve their quality of life. These machines offer a chance at a relatively normal life, even with failing kidneys, allowing patients to continue with their daily activities and enjoy life.
In critical situations where the heart and lungs are severely compromised, traditional treatments such as mechanical ventilation or medications may not be enough to sustain life. This is where advanced medical interventions like ECMO come into play, offering a vital lifeline to patients in need. Extracorporeal membrane oxygenation, or ECMO, provides a lifeline by taking over the function of the heart and lung. It is a sophisticated technology that can mean the difference between life and death for patients in dire conditions, especially when other treatments have failed. ECMO is a highly specialized form of life support that acts as an external heart and lung system. It is used when the patient's own organs are unable to function properly on their own, providing critical support during the most severe health crises. Dr. ECMO involves channeling blood outside the body to a machine where it is oxygenated and carbon dioxide is removed. This process is meticulously monitored by a team of healthcare professionals to ensure the patient's safety and to make real-time adjustments as needed. This machine removes carbon dioxide and adds oxygen to the blood, effectively performing the gas exchange function of the lungs. The process mimics the natural function of the lungs, providing essential gas exchange and maintaining the patient's oxygen levels. The oxygenated blood is then pumped back into the body, supporting the function of the heart and lungs. This allows the patient's organs to rest and heal, giving them a chance to recover from the underlying condition that necessitated ECMO. ECMO is a resource-intensive treatment, often used in cases of severe pneumonia, heart failure, or other critical conditions where conventional treatments have failed. It requires a dedicated team of specialists and continuous monitoring to ensure the best outcomes. It is also employed following major surgeries, especially when the heart or lungs need additional support to recover. ECMO can be crucial in stabilizing patients post-operatively, allowing them to recover more effectively. It gives the heart and lungs a chance to rest and recover while the machine takes over their workload. This period of rest can be crucial for the patient's recovery, providing the necessary time for healing and reducing the strain on the body's vital organs. While ECMO is a complex and risky procedure, it offers a chance of survival for patients facing life-threatening conditions. The decision to use ECMO is made with careful consideration of the potential benefits and risks, always aiming to provide the best possible outcome for the patient. The multidisciplinary team works together to ensure that ECMO is used effectively and safely, maximizing the chances of recovery.
Section 5. Why life support? Understanding the goals and purposes.
Life support is not about prolonging death. It's about supporting life. It encompasses a range of treatments and technologies designed to maintain vital functions when the body is unable to do so on its own. This can include mechanical ventilation to assist with breathing, dialysis to support kidney function, and medications to maintain blood pressure and heart function. These interventions are critical in stabilizing patients who are in life-threatening conditions, providing them with the necessary support to survive and recover. The goals of life support vary depending on the patient's condition and prognosis. For some, it may be a temporary measure to overcome a critical period, while for others, it may be a long-term necessity. The medical team continuously evaluates the patient's response to treatment and adjusts the care plan accordingly. This ongoing assessment ensures that the interventions remain appropriate and effective, and that any changes in the patient's condition are promptly addressed. In some cases, life support is a temporary measure. It can provide critical support during a severe illness or after a major surgery, giving the body time to heal and recover. This temporary support can be crucial in stabilizing the patient and preventing further complications. For example, a patient who has undergone a complex surgical procedure may need mechanical ventilation for a few days to ensure adequate oxygenation while their body heals.
It provides a bridge for patients to recover from acute illnesses or injuries. For instance, a patient with severe pneumonia might need a ventilator to help them breathe until their lungs are strong enough to function independently again. This temporary use of life support can be life-saving, allowing the patient's body to fight off the infection and regain strength without the added stress of struggling to breathe.
For example, a patient on a ventilator after surgery may only need it for a few days until their lungs heal. This short-term use of life support can make a significant difference in the patient's recovery process, ensuring they have the best chance of regaining full health. The medical team closely monitors the patient's progress, gradually weaning them off the ventilator as their condition improves. In other cases, life support may be needed long-term. This is often necessary for patients with chronic conditions that impair vital organ function, such as advanced heart failure or severe neurological disorders. These patients may require ongoing support to maintain their quality of life and manage their symptoms effectively, allowing them to live as comfortably and independently as possible.
This is often the case for patients with chronic illnesses that permanently affect vital organs. These patients may rely on life support systems to maintain their quality of life and manage their symptoms effectively. For example, a patient with end-stage renal disease may need dialysis several times a week to filter waste products from their blood, a function their kidneys can no longer perform.
For instance, someone with end-stage lung disease may require long-term ventilator support. This ongoing assistance can help them breathe more easily and improve their overall comfort and well-being. The ventilator provides the necessary respiratory support, reducing the work of breathing and allowing the patient to conserve energy for other vital functions. The decision to use life support is never taken lightly. It involves careful consideration of the patient's medical condition, the potential benefits and risks of the treatment, and the patient's own wishes and values. This decision-making process is collaborative, involving input from the medical team, the patient, and their family, to ensure that the chosen course of action aligns with the patient's best interests. Doctors, patients, and families carefully consider the potential benefits, risks, and the patient's wishes. This collaborative approach ensures that the chosen course of action aligns with the patient's best interests and respects their autonomy. Open communication and shared decision-making are key components of this process, helping to build trust and ensure that everyone involved is on the same page.
Ultimately, the goal is to provide the best possible outcome and quality of life for the patient. This means not only addressing their immediate medical needs, but also considering their long-term well-being and personal values. By taking a holistic approach to patient care, the medical team can ensure that the interventions provided are in line with the patient's overall goals and preferences, promoting a sense of dignity and respect throughout their treatment journey.
Section 6. When machines falter, the reality of life support failure. Life support machines are generally reliable, designed with advanced technology to sustain critical bodily functions. But they are not foolproof. Despite rigorous testing and quality control, unforeseen issues can arise. Like any machine, they can malfunction or fail due to technical glitches, power outages, or wear and tear over time, potentially putting the patient at risk. Such failures can lead to critical situations where immediate intervention is necessary.
Hospitals have strict protocols in place to minimize the risk of life support failure. Regular maintenance checks, backup power supplies, and routine inspections are conducted to ensure optimal functionality. And alarm systems are standard safety measures. These systems are designed to alert medical staff immediately if something goes wrong. Medical staff are trained to respond swiftly to any alarms or malfunctions, ensuring that any issues are addressed promptly to prevent harm to the patient.
In the event of a machine failure, they are prepared to provide immediate backup support to the patient, utilizing alternative equipment or manual methods to maintain vital functions. While life support failure is a serious concern, it's important to remember that these events are relatively rare. The combination of advanced technology and vigilant monitoring significantly reduces the likelihood of such occurrences. Robust safety protocols and vigilant medical professionals work diligently to ensure patient safety, constantly reviewing and updating procedures to adapt to new challenges and technologies.
Section 7. The human element. Ethical and emotional decisions. Life support decisions are never simply medical. They are deeply personal and ethically complex, involving the values, beliefs, and emotions of everyone involved. Weighing the benefits of life support against the potential burdens it may impose is a difficult task, requiring careful consideration of the patient's quality of life and the emotional toll on the family.
Discussions about end-of-life care, advance directives, and the patient's wishes are crucial, as they help ensure that the patient's preferences are respected and guide the medical team in their decisions. Open and honest communication between doctors, patients, and families is essential to navigate these challenging decisions, fostering understanding and trust among all parties. In situations where a patient is unable to communicate their wishes, families face agonizing decisions about continuing or withdrawing life support, often feeling the weight of making the right choice for their loved one.
These decisions are often emotionally charged, and there are no easy answers, as families grapple with their own emotions and the ethical implications of their choices. Support groups, spiritual advisors, and mental health professionals can provide invaluable support during these challenging times, offering guidance, comfort, and a space to share feelings and experiences.
Section 8. Advancements in life support. A look at the future. The field of life support is constantly evolving, with new technologies and methodologies being introduced regularly to enhance patient care. Researchers and engineers are tirelessly working on developing new technologies such as advanced ventilators and ECMO machines to improve patient outcomes and streamline critical care processes.
Portable and miniaturized life support devices like wearable defibrillators and compact dialysis machines are being designed to give patients more mobility and independence, allowing them to lead more normal lives outside the hospital. Artificial organs, such as bioengineered hearts and kidneys, and regenerative medicine techniques, including stem cell therapy, hold promise for providing long-term solutions for organ failure, potentially eliminating the need for transplants.
Artificial intelligence is also playing an increasing role in life support, with AI-driven systems capable of analyzing vast amounts of data to assist in decision-making and patient monitoring. Smart algorithms can monitor patients' vital signs and adjust machine settings in real time, potentially improving safety and effectiveness by responding to changes in a patient's condition more quickly than human intervention alone. These advancements offer hope for even better outcomes for patients who rely on life support, providing them with a higher quality of life and better chances of recovery. The future of this field is bright, driven by a relentless pursuit of innovation and a commitment to preserving life, ensuring that patients receive the best possible care through continuous advancements in technology and medical practices.
Section 9. The gift of time. Life support's enduring legacy. Life support machines are marvels of modern medicine, designed to sustain life when critical bodily functions fail. They offer the gift of time, precious moments that allow the body to heal from severe trauma or illness. Time for the body to heal, giving patients a fighting chance to recover from conditions that would otherwise be fatal. Time for families to gather, providing emotional support and making critical decisions together. And time for difficult decisions to be made, ensuring that every option is considered with care and compassion.
While these machines can be imposing, their presence is a beacon of hope for many. It's crucial to remember the lives they help sustain, offering a second chance to those in dire need, and the hope they represent, a testament to the resilience of the human spirit. They embody the human spirit's determination to fight for life, even in the face of incredible odds and uncertainty. Even in the face of incredible odds, the dedication of healthcare professionals and the will of patients shine through.
Life support technology is a testament to medical progress, showcasing the advancements that have been made in critical care, and a powerful reminder of the preciousness of life itself, highlighting the importance of every moment we have.